So the way that our bodies function is our bones are our skeletal structure. Our muscles are what moves the bones, but the connecting piece between muscle that attaches to the bone is actually the tendon. So the example I have here is a knee replacement, but we're going to use the patellar tendon as an example. The way that this works is that our muscles are attached to the patellar tendon. The tendon goes all the way down and attaches to the tibia. And so when a muscle contracts, it causes the bone to move because the muscle's attached to tendon. Unfortunately, we can have muscle tears which heal very well. What doesn't heal well are the tendons. And that has to do with how the blood supply to the tendon is and how the function of the tendon works. So sometimes in orthopedics, we have to repair the actual tendon, whether that's up in the shoulder with the rotator cuff, it's in the elbow with the biceps tendon rupture, which is fairly common. It's also very common down in the knee, where we have either a patellar tendon rupture, Achilles tendon rupture in the foot, or a quadriceps tendon rupture. Usually a patellar tendon rupture is usually in the younger patients. Quadriceps tendon rupture, which is the tendon from the muscle to the first part of the knee, can rupture. And when we do that, what we have to do as orthopedic surgeons, we have to, number one, find out, is it completely torn? If it's a partial tear, meaning a partial tear is a very broad diagnosis that could say, hey, it's everything from a very small amount to a almost full thickness all the way to the end. So it's a very broad diagnosis. When I say partial, I'm talking about 50%. So as orthopedic surgeons, what we would do to fix that is we end up bringing the tendons together by sutures and then being able to put them back down. If they've pulled off the bone, we repair them back down to the bone with different anchors and different things to hold it against the bone. That's the easy part, is what we have to do to bring the tendon together. The hard part's going to be the recovery. And that's because it's going to take time for the body to repair the tendon. Even though we put it back together, these sutures and all the different mechanisms we use to bring the tendon back together is only going to work for so long. When the body needs to recover and heal, because remember, as we're walking and moving and standing and using our tendons, they require us to pull on them in order for us to stand, walk, and move. But during the recovery process, we can't be using them at all. So let's say it's your patellar tendon we have to reconstruct. We can't do walking for about 6 to 8 weeks. That tendon is required as we're walking and standing to be used. And during that recovery process, we can't, because the more we pull on it, the more the body was putting fibrous tissue and scar tissue to heal it. If we pull on it, that scar tissue will rupture. What the process is with the recovery is going to be non-weight bearing or non-using that extremity that we've helped reconstruct, but still maintaining what we call passive motion. Passive motion versus active motion. Active motion means you're using the tendon to pull and move. Passive motion means that you're just moving the joint and the tendon's going along for the ride passively. So we maintain our joint mobility by doing passive motion. Once we have good mobility in our joint, it's been enough time, we can start using that limb again. Then we do some physical therapy over time, increasing our active motion and getting our strength back to normal. So the process can be somewhere between 6 to 12 weeks, a little bit longer for returning to sport. So if you're doing rotator cuff surgery, it's going to be more like 4, maybe even to 6 months before you're pitching if you're a baseball player. Again, the whole process is repairing the tendon, getting the mobility back to normal, and then getting the strength back to normal, with the idea that eventually that tendon has healed and it's healed well, you'll be able to get back to full recovery.